oral webinar series. Today, we're going to be talking about air pollution and brain and mental health. This webinar is co-organized by the Global Mental Health Action Network and the Health Effects Institute, where I work. My name is Pallavi Pant, and I'm very excited to welcome you all to today's session, where we will talk a little bit about what we know around exposure to air pollution and how it impacts our brain and our mental health. We have an exciting lineup of speakers here with us today to tell us a little bit more about what they've been working on. But before we get started, I just want to set the scene a little bit, thinking about air pollution and health in general, what we know and where some of the gaps around our understanding on air pollution and brain and mental health are. So if I can pull up my slides, we know, for instance, that air pollution is a big environmental health risk factor. And one of the things that we at the Health Effects Institute have been doing for a few years now is run this initiative called the State of Global Air, which is actually the partner for today's webinar with the network. And through this initiative, we've been tracking long-term trends in air quality levels in countries around the world, as well as health impact. So what are the ways in which air quality levels are changing and how that is impacting people's health? These are global estimates. We try and provide data for every country. And we do this work in partnership with an organization called the Institute for Health Metrics and Evaluation. And just a few months ago, we released our latest report. So I'll talk you through some of those high level findings. But just to give you a sense of the types of information that is available, we have data on a variety of different pollutants, including fine particulate matter or PM2.5, as well as nitrogen dioxide and ozone. We also have data on a variety of health outcomes on the website, which you can access for countries or cities or even at the regional scale. And finally, some of the resources on the State of Global Air website are available in multiple languages. We will continue to expand the language base as well. So if any of you are interested in specific resources, even around the topics we will be covering today, please do get in touch. We would love to work with you. The reason why we wanted to take the time today to talk about air pollution and brain and mental health really was that for 2021, which is the year where the latest data are now available, we know that air pollution was among the largest risk factors contributing to deaths around the world. In fact, 1 in every 8 deaths that happened in the year 2021 was linked to exposure in air pollution, resulting in over 8 million deaths. So that's a pretty big number. And the largest impacts for these exposures to air pollutants were seen in regions including South Asia, where there were over 2.5 million deaths, and in Africa, where there were over 1 million deaths. So these are big numbers, big health impacts. And air pollution is not just impacting, us because of these impacts in terms of deaths. It is also impacting us because some of us may live with diseases, chronic diseases. Others may need to take care of their family members or loved ones over long periods of time. So it really has impacts on how our society functions, our productivity, the amount of medical care costs we might have, etc. So it's, deaths plus plus. And some of those impacts may be not as well understood as we will hear from our speakers today. What we also know is air pollution tends to impact the youngest and the oldest among us in the largest way. So, what you see here on this really busy chart is essentially how air pollution is contributing to deaths across different age ranges. And you'll see big spikes at the very beginning, so the earliest periods in our life, and then bigger spikes towards the later stages of life. As we get older, we tend to see those huge impacts. And the colors essentially indicate pollutants, so that's less important for today's conversation. And then when we come to today's topic, brain and mental health, the evidence has been piling up. We are learning with each new research study how air pollution is also impacting our mental health and our brain health, in addition to the more common effects that we already know about, including impacts on our respiratory health, so our lungs, as well as cardiovascular health, our heart. And I've just highlighted here 3 recent examples of studies that have been published. One of them was a review looking at the exposure of air pollution and its impact on dementia in older adults. So the risk of dementia going higher if you're getting exposed to higher levels of particulate matter, especially fine particulate matter, as well as studies that are now starting to show that exposure to air pollution, whether indoors or outdoors, may be resulting in mental health outcomes. And our speakers today are going to talk a lot more about it, so I won't give you many details here. But one statistic I do want to point out, which is a few years old now, but one of the first estimates, global estimates for how air pollution may be impacting dementia in particular, was done for the year 2015. So this number is not comparable to the results I showed you earlier. But the study reported that over 500,000 dementia deaths in the year 2015 were due to exposure to fine particulate matter or PM2.5, essentially the particles in the air. And this analysis was the first step in potentially including these impacts into the global burden of disease or understanding of, the large 8 million number that we see doesn't account for dementia yet, doesn't account for some of the other brain health outcomes. So hopefully we will see that in the future. But if you look at that large 8 million deaths number, then on top of it, there may be additional thousands and thousands of deaths as a result of exposure to air pollution and the impact due to dementia. So I'm looking forward to our speakers giving us a better sense of what those associations are, where some of the recent data is going, and how we can begin to address this. It's not just about understanding the science, but also figuring out what are the solutions, what are the ways in which we are trying to reduce this large burden of disease. So, with us today, we have three excellent speakers, and I would now like to take an opportunity to welcome our first speaker, Dr. Joanne Newbury, who is a research fellow at the University of Bristol and has done fascinating work looking at large data sets and large cohorts of people connecting air pollution with a variety of mental health outcomes. Dr. Newbury, welcome. The floor is yours.
Thank you, Pallavi. Yes, I'm Joanne Newbury, and it's a real pleasure to be joining this webinar. So if you could upload the slides, please. Thank you. So starting with research perspectives on the effects of air pollution on mental health. So yes, the physical health effects of air pollution are, of course, well established. Air pollution contributes to cardiovascular and respiratory illnesses like stroke, heart disease, and lung cancer and asthma. And it's estimated to cause millions and millions of premature deaths each year worldwide. But only relatively recently has growing evidence on air pollution and mental health started to emerge, with evidence in particular related to psychotic disorders such as schizophrenia and mood disorders like depression. This includes incidents and hospital admissions at the more severe end of the spectrum, but also the evidence includes subclinical symptoms in the general population. And why is this a problem? Well, it's thought that poor mental health will be the biggest health burden worldwide by 2030. Very briefly, thinking about the sources of air pollution. So air pollution includes gases and particles in the atmosphere which harm humans, animals, plants, and the climate. And while there are natural sources of air pollution, such as wildfires and volcanoes, the biggest sources nowadays are man-made, such as industry, transport, and domestic activity. And as I mentioned, there's growing evidence linking air pollution to mental health, but the field has faced some research challenges. Firstly, it's been difficult to establish causality. For one thing, air pollution is highly correlated with other adverse environmental exposures, such as deprivation, urbanicity, and noise pollution, and these might confound the observed associations. Secondly, studies have often been cross-sectional or had relatively short-term follow-up, and so the importance of developmental timing and duration of exposure is uncertain. And finally, the earliest studies often relied on fairly crude pollution data, such as distance to major roads. And so I'll now describe two studies that I was involved in, which aimed to address some of these challenges, both of which were based in the UK. So the first study was based in South London, and it included a highly urban and ethnically diverse population. And in this study, we investigated the association of air pollution with illness severity among people diagnosed with a first episode of psychotic or mood disorder. The second study was based in the southwest of England, in and around the city of Bristol. And this catchment area covered a range of urban, suburban, and rural settings with a predominantly white ethnic population. And in this study, we investigated the long-term associations of exposure during pregnancy, childhood, and adolescence with subsequent psychotic symptoms, depression, and anxiety between the ages of 13 and 24. So the first study was based on electronic health records from the South London and Maudsley NHS Foundation Trust on nearly 14,000 service users who had first episodes of psychotic or mood disorders between the years 2008 and 2012. And a spatiotemporal model was used to estimate air quality down to a 20 by 20 metre grid resolution, so effectively address level. And this was used to estimate the exposure that service users had experienced at their addresses during the 3-month period when they had their first episode. And the 4 pollutants we investigated were nitrogen dioxide, nitrogen oxides, fine particulate matter, and coarse particulate matter. And these were especially interesting to us given that they are very prevalent and they're highly potent toxins with known physical health effects. We then recorded how much the service users had used inpatient services and community mental health services over 1 year and 7-year follow-up periods following their first episode. And we focused on inpatient use and community mental health service use because people with the most severe course of illness would usually require more contact with services. And so in this way, inpatient use and community service use provide a proxy for illness severity. And after adjusting the results for a range of potential confounders listed on the top of the slide, we found that every 25% increase in air pollution was associated with between 11% and 18% more inpatient use after 1 year, depending on the air pollutant. Furthermore, every 25% increase in air pollution was associated with between 7% and 32% increased community mental health service use after 1 year. We also found that these associations extended for the full 7-year follow-up, suggesting long-term effects of pollution exposure on subsequent illness severity. So moving now on to the second study, we used data from the Avon longitudinal study of parents and children, also known as the Children of the 90s, which is based in the southwest of England, particularly in and around the city of Bristol. The cohort was formed with over 14,000 pregnant women in 1991 to 1992, and the babies, who are now adults, have been tracked over time. And air pollution levels, including nitrogen dioxide and fine particulate matter, were estimated for the participants' home addresses using a different type of model called a land use regression model. And this provided estimates at a 100 by 100 metre grid resolution, so still quite granular, but not quite so precise as the previous study. And we focused on exposure during 3 developmental stages, including pregnancy, childhood, defined as birth to age 9, and adolescence, defined as ages 10 to 12. And a novel aspect of this study is that we also obtained address level noise pollution data, which allowed us to tease out the effects of air and noise pollution. And participants were interviewed about whether they had psychotic symptoms, which include hallucinations and delusions, as well as depression and anxiety between the ages of 13 and 24. And after adjusting the results for the potential confounders listed at the top of this slide, we found that every 25% increase in fine particulate matter in pregnancy and childhood was associated with between 9% and 11% greater odds for psychotic symptoms and depression. In contrast, higher noise pollution in childhood and adolescence was associated with greater odds for anxiety. So we found some evidence of specificity in terms of pollutant, timing, outcome relationships. So to summarise, in 2 different UK populations with different socioeconomic, geographic and demographic compositions, we found that higher air pollution was associated with increased illness severity among adults with psychotic and mood disorders. And looking back in time at earlier exposure, we found that exposure to air pollution during pregnancy and childhood was also associated with common youth mental health problems, including psychotic symptoms and depression many years later. So thinking about mechanisms, so several are plausible, including neuroinflammation and oxidative stress, but I won't go into detail here as I think the next speaker may touch more upon this. So there are still remaining research challenges in the field. So for one thing, the causality of the findings remains uncertain. And I think something that holds promise in terms of addressing causality is that it's now possible to leverage clean air zones, which are being introduced in many parts of the world. And these clean air zones provide quasi-experimental evidence on whether cleaner air protects mental health. Another challenge, as is often the case, is there's more research on this topic being carried out in Northern Europe and North America. And in my own research, I've only investigated the Air Pollution Mental Health Association in the UK. And there are many parts of the world, particularly low and middle income countries, with much worse air pollution and also with much lower availability of mental health provision. So lastly, just to say a huge thanks for listening and a big thank you to my funders and collaborators listed here, particularly the senior authors for each study, Dr. Pakolis and Professor Zammit. Thank you very much.
Thank you very much, Dr. Newbury. That was fascinating, and I think also, understanding that even with studies that you've done just in the UK with relatively large groups of people, you're finding these very specific impacts. I think is really important for all of us to take note. And the point that you mentioned towards the end about a lot of studies having been done primarily in high income countries at the moment is so true, because even for this webinar, we really tried very hard to find a speaker from a lower middle income country, and we really struggled. So if anyone's here, I know several people mentioned they're from different parts of the world. We really need people to be doing more of this work in many parts of the world. And we'll get to some of that during our discussion section. Also, if any one of you listening in have questions, please do put them in the questions section. We will get to that in a few minutes. I would now like to invite Dr. Burçin İkiz, who is the chair of the International Neuroclimate Working Group at the Columbia University, and also an award-winning neuroscientist who's been working on the topic around neurodegenerative diseases for a while. So very excited, Dr. İkiz, to hear from you about air pollution and brain health. Over to you.
Thank you very much, Pallavi, for your kind introduction and for all of you having me here today. And Joe, what a great presentation. It's actually really matches with some of the things I wanted to discuss, and really, really interesting work. And today I would like to talk to you, give you an overview of air pollution and the implications in the research world on brain health. And I'm a neuroscientist, as Pallavi had mentioned, studying the neurodegenerative diseases and various other childhood neurological disorders. And when we talk about brain health, normally we do want to combine mental health and neurological health together, since mechanistically they have a lot of correlations to that mechanisms that work together in the brain. But since Joe had done a wonderful job focusing on the mental health, I'll be talking more on the neurological side of what we know about implications. Pallavi already did a wonderful introduction with much up-to-date data on what air pollution does and its global impact on human health. We know that more than 90% of the global population is exposed to air pollutants that exceeds the World Health Organization's guideline limits. We know that from the most recent data that came from 2021, that more than 8 million premature deaths are linked to air pollution, and that these can have short-term and long-term health effects, including cardiovascular diseases. And we know a lot more around respiratory, what it does to respiratory systems, immune systems, and cardiovascular systems. And we're just starting to understand what it also does to our brain health. What happens mechanistically in the brain is that air pollutants make our blood-brain barrier leaky. So this barrier is normally there to protect our brain through the toxins that enter the bloodstream. But with the air pollution and sometimes exposure concurrently to other factors such as extreme heat that happens during the case of, let's say, wildfires and so on, our blood-brain barrier becomes leaky and allows the toxins to be entering into the brain. This then causes in various parts of the brain neuroinflammation that then leads to neurodegeneration. We know that myelin, which is the part that makes the information processing to happen much faster between the neurons, can get really harmed and at places break down, which results in the people having some cognitive symptoms that really slows down the processing of information, memory, cognition, and so on. And we also know that the air pollution can affect the gray matter, where most of the neurons reside, that is linked to all the other effects, parts of the brain that considers doing complex tasks and memory. And epidemiological observational studies, such as the one that Joe has been part of and had shared with us earlier, can really have an impact on our brain health throughout our lifetime, and that these effects can be intergenerational. There were similar cohort studies that had been done, similar to what Joe had shared in Bristol and other parts of the UK. There were also some studies that had started in 1998 that was led by Columbia University by Professor Pereira's group, where they had looked at pregnant women starting from 1998 until the 2020s in Harlem, New York, and Krakow, Poland, where they had really high levels of air pollutants in the air. They had measured, they literally put sensors on the pregnant women's bellies, and they did a routine blood work. These cohorts were much smaller and were able to measure the amount of air pollutants that these mothers were exposed to. And then they looked at these mothers and their children over their lifetime until early adulthood. What they had seen was that these children, first of all, were born prematurely, and they were at lower birth weight, which really affects their development and brain and body development. But they were also able to see structural changes in these fetuses' brains at the parts of the corpus callosum and other parts of the structural changes in the brain that affected the hippocampus and other places. These children then at the infancy, when they were measured, had some neurodevelopmental delays. They were slower to learn how to walk and how to talk. and that in the early childhood they had done some behavioral assessments and IQ tests and had found that these children had lower IQ scores, attention scores, and had increased risk of being diagnosed with autism and attention deficit hyperactivity disorder. As Joe had mentioned, similar to what they had found in their studies in the UK, that then these children at the early adolescence to early adulthood had higher risk for being diagnosed with depression and anxiety. And so children are really at very critical stage of being, especially their brains, because it's developing so fast and going through a lot of rewiring, are really sensitive to the impacts coming from the air pollution. But they're not the only ones that are affected. Also, as Pallavi had mentioned, the population, the elderly population, people that are in the later stages of their lives, are also at increased risks of developing dementia, Parkinson's disease, and stroke due to air pollution. In fact, of the most recent Lancet report had listed 14 risk factors that can be modifiable for dementia. And one of them is considered, one of the highest ones that are happening at the later stages is considered air pollution. And according to the numbers from the American Alzheimer's Association, the number of people with dementia are expected to triple by 2050. But these numbers never put into account of what could be happening from the due to environmental factors such as climate change and air pollution. And what we're now expecting is that this number not only triple, but quadruple, and might be happening at much earlier stages, where people are developing dementia and other neurodegenerative diseases, not only at ages of 60, 70, 80, but even earlier stages. And these effects can be intergenerational, so you don't even have to be born to be really impacted by air pollution. And we had these observations that one of the problems with research that Joe had mentioned was really being able to link causality. And this is an important problem to really understand how to interpret the observational epidemiological data, cohort studies that Joe had mentioned and I had mentioned earlier. What does it really mean in terms of what it does to the brain? And there had been several animal studies that have been done that had shown that prenatal exposure to air pollutants such as PAH and PM 2.5 can actually show that there could be some changes, structural and changes in the brain that cause the hippocampus to release less brain-derived neurotrophic factors and certain serotonin receptors that can be linked to then changes in behavior in animal models that correlates and converges with the data that comes from these studies of observational human psychiatric studies looking at the psychiatric risk of air pollution. This is as close as we have gotten in the molecular and cellular neuroscience to be able to find some kind of causality of really these of how air pollution might be affecting the brain health. But there needs to be, as Joe had mentioned also, that there needs to be more studies in this area to really be able to understand the mechanisms and link causality to these studies. But there's hope. While we have been seeing these effects and seeing these results can be scary because where the children can be their brains and their development affecting them and their societies for a lifelong, and also the elderly population and other vulnerable communities, especially the frontline communities that are most exposed to air pollution and the effects of climate change. Our brains are really plastic, wonderful organs, and they're very resilient. Thanks to neuroplasticity, given the opportunity and taking away the harmful effects, they can rewire themselves and they can repair themselves. But we have to give it to the opportunity. And I think my colleague after me will be talking more around this solutions aspects of it. but I want to give you one sort of success story, and that has been also been multiplied by different countries. And this was the Clean Air Act that had passed in 1950s in the United States. This was far from being a perfect act, and had to be modified multiple times. But according to the measurements from the Environmental Protection Agency, this act was able to clear about 73% of the air pollution in the United States, and is considered a milestone in public health policy. And certain data that had come from studying the effects of this act had shown that showed huge improvements in lowering of the premature deaths and improving the health of individuals living in these states that had passed the act. But again, they are limited, and this is a constant problem that we have to address and target. So some of the things we can do, I can go under three pillars. On the research side, we really have to work with interdisciplinary teams, neuroscientists working with epidemiologists and environmental scientists, and psychologists and healthcare professionals to really pinpoint what's happening and to our brains because of air pollution. And we have to really be able to address these gaps of and find and address the gaps of in the research where we can really pinpoint, such as the one that Joe had mentioned, focusing on causality, focusing on mechanisms. And we have to get the word out there. We have to be talking with healthcare professionals, doing educational campaigns, such as the ones that we're part of right now, to really inform people from different parts of the government policy, health policies, public health, to what that the air pollution's impact is not limited to cardiovascular diseases. It's not limited to respiratory, but our brains are hugely impacted by it too. And finally, we have to go through preventional and adaptation and really implement thinking about how, on policy side, how to protect our brains at the implementation state, put it into local, national, and global adaptation strategies, come up with screenings for early neurological and mental health interventions, and be able to build resilience into the healthcare system. With that, I would like to thank you for your attention, and I look forward to answering some of the questions you may have later in the talks. Thank you.
Thank you very much, Dr. Ikez. I think that was, fascinating, not just in terms of how the biology of these impacts might be working, but also some very practical sort of ideas you gave to all of us on how to move this agenda forward. And I will, just reiterate this point that for a lot of people that may be working in the mental health or brain health space and also in the air pollution space, that link between these two is not always as clear. I was at a meeting in Nepal just last week, and we did, a very informal survey of what parts of human body did people think air pollution impacts, and everyone thought it was the lungs. Some people said, yeah, maybe, the heart. And then we started getting into things like diabetes and brain health, and people were just amazed that those are ways in which air pollution is impacting us. So we really need a lot more of this conversation. And I think as you, said towards the end of your talk, the other really important piece is to be thinking about solutions and, how are we going to continue to find ways to mitigate this problem or address this problem, even as we're learning more about it. So I'm very excited to now welcome Dr. Tama Carlton, who's from UC Berkeley. She's an environmental economist. Very happy also that we're bringing together various disciplines already, even in this conversation. And she works with large data sets, with big data, large geospatial data sets to look at environmental change and development and health. So, Dr. Carlton, over to you.
Thanks so much. Very excited to be here. So I'm going to give a bit of a solutions perspective from China, which is a place where we see about 16% of global suicide deaths and an enormous share of the overall mental health burden, just given the size of the country and the overall exposure to air pollution. So We've been talking broadly about brain and mental health. I'm going to talk about a very extreme and stark indicator of mental health, which is suicide. Over 700,000 lives are lost annually to suicide. You can see in this map that the burden of suicide is very heterogeneous across global nations. But of course, again, I'm thinking about this as an indicator of a much broader mental health crisis in which at least 300 million people are suffering globally from depression. But given the solutions angle here, one thing I want to point out is that what we've seen in recent decades is a declining rate of suicide in nearly all countries around the world. So you can see in the graph that global average suicide rates have been falling. This is true also in OECD economies as well as low and middle income countries. However, as we've been discussing sort of the complex nature of mental and brain health, the explanations for these declines are very complex. We have social, economic, cultural factors also at play alongside possible environmental factors. And as Bertrand pointed out, actually both speakers have pointed out, understanding and sort of unpacking these different explanations has been particularly difficult in low and middle income countries, often due to data constraints. But these are the places where about 80% of global suicide deaths are taking place. So we are going to try to contribute to filling this research gap in China, in a place that has seen perhaps the most dramatic drops in suicide rates around the world. You can see that in the red line on the right graph. And in particular, we're looking at air pollution and suicide in China. So we're first going to attempt to make a causal connection between levels of air pollution and rates of suicide in China. I'll talk a lot about causality, as everyone has. It's incredibly important. And then, given those empirical estimates, we're going to ask how much of China's suicide rate decline that we just observed in that last slide can be attributable to improving air quality. And we're going to do this in a time period in which the government enacted very aggressive air pollution control policies starting in 2013. And you can see the graph on the left, that blue line is showing you this steady decline in air pollution over the period 2013 to 2017. At the same time, suicide rates are falling. Of course, many other factors are at play here. And so our job is to try to untangle how much of that suicide rate decline can we really attribute to these air pollution policies that have dramatically reduced pollution around the world. And around the country. You can see the sort of varied declines in pollution in the map on the right, but in general, most of those regions are blue where we're seeing declining pollution over this period. So I'm not going to get into mechanisms. There are people much more expertise in this. I just want to point out that we're going to study this from a sort of population data perspective, in which I'm going to try to link changes in suicide to changes in air pollution. There are a lot of possible mechanisms that could be at play. Those include the neurobiological mechanisms that Bertrand pointed out, as well as some other sort of more social or economic possible mechanisms. So in epidemiology, there's evidence, or at least suggestions, that this could be a much more indirect channel between changes in particulate matter and changes in suicide risk. So it could be that physical health is affected, or even economic productivity losses, which, as an economist, there's a whole body of work on how air pollution affects our productivity at work. And it's possible that depressed incomes or lower physical health later on leads to mental health challenges and ultimately suicide risk. So it could be these direct neurobiological channels, but it could be also broader indirect channels at play. So we've talked a lot about the challenge here of causality. This, in general, I just think about this as most of the emissions that are creating air pollution are caused by humans. So that means that every time we're seeing higher or lower levels of pollution, this is also happening alongside changing traffic patterns, holidays, manufacturing activity, many different things that are changing in society. And it's very hard for us to pull out just the effect of air pollution. So what we're going to do is a quite different approach to causality than you've seen in the rest of the presentations. We're going to use these random meteorological events that are called thermal inversions. And these inversion events trap air pollution near Earth's surface. I'll show you a picture in a minute. And that means that for the same amount of anthropogenic activity, emissions happening from the surface, exposure to that pollution for humans on the ground changes a lot, whether inversions are happening or not. And we're going to leverage that to try to isolate pollution from all of the economic activity that's happening alongside it. So just to give you a picture, usually when we emit things from cars and manufacturing activity at the Earth's surface, it's distributed vertically, rising through warmer and then cooler air. What happens in an inversion instead is that a layer of warmer air comes in. This can be due to rapid overnight cooling. It can come in from storm fronts. There are a variety of different meteorological conditions that can generate this, but basically it's trapping pollution near the surface, which means that for the same amount of emissions, people are getting much more pollution exposure. So first, we show that those inversion events do meaningfully increase air pollution on the ground. This has been shown in prior work, but we show that it's true across China in a representative sample of about 700 counties. So these estimates are showing you that when we have one additional thermal inversion, we're raising weekly average fine particulate matter by about 1%. That's robust to a variety of different ways of characterizing inversions, the strength of them, how many days you have with inversions. We then use this variation caused by this meteorological event to then translate changes in the pollution into suicides. And we find that a standard deviation increase in fine particulate matter substantially raises the weekly suicide rate. We have weekly data on suicides. One standard deviation raises it by about 25%. Now, importantly, maybe a little bit hard to see on this graph, but that main point estimate I just described in the dark gray is very different relative to a correlational estimate that does not use those thermal inversion events. And so that sort of gap between those two coefficients shows you the challenge of causality. If you don't have a way to isolate pollution from all the other things that are happening, we can really poorly estimate these effects. But when we use these inversion events, we find a very robust estimate. I won't bore you with the statistical details, but sort of whatever you throw at this model, we're seeing really consistent effects. Building on a lot of the conversations about life stage that we saw before, we do a variety of tests to try to investigate who in the population is most vulnerable. And consistent with a lot of prior epidemiological work on age and some work on gender, we find that older women are the most susceptible. So to see this visually, that's our main estimate. But if you look over, I don't actually know if you can see my mouse, but if you look at sort of the farthest right orange dot, that is the effect for women over 65. They see an increase of 63% in their risk of suicide for a standard deviation increase in pollution compared to that 25% on average in the population. Older men are also more susceptible. That result is noisy, but we're really seeing the effect concentrated in the population of older women. The effect is also slightly larger in spring and summer, consistent with some other epidemiological evidence. There's not a lot of difference across urban, rural, rich, or poor. But we do, in this last bottom row, we're seeing a much larger effect in places with high average suicide rates, potentially consistent with what's called a suicide contagion effect, in which when there's average high suicide rates, these additional environmental stressors can have a larger impact on a population. One other timing was mentioned in both of the prior talks, and we have weekly data only over a 5-year period. So a lot of the really lifelong chronic type exposures that have been discussed previously are not feasible to estimate in our data. But we do want to think a bit about timing to the extent that we can here, because those neurobiological channels may take place over very different time frames than something like pollution affecting physical health, which later affects mental health and later affects suicide risk. And what we saw, somewhat surprisingly to us, was that this effect appears to be very rapid and very short-lived. So what you're seeing in the effect above the 0 on the lag length on the x-axis is indicating that the elevated suicide rates are taking place exactly in the week in which these inversion events are raising air pollution, instead of seeing any evidence of lagged effects. So if you see pollution this week, we have no higher risk of suicide in following weeks. It's really taking place in the week of the event. Importantly, these effects also do not show any compensating evidence of compensating effects, which means that we're not just seeing air pollution move suicides forward in time. So a high pollution event is not taking someone who is at risk of suicide in the next period and moving it forward. We're actually seeing additional effects from these elevated levels of air pollution, but they appear to be very rapid and short-lived. So the last sort of stage of this analysis is to bring it back to this question of, okay, we have these two trends taking place at the same time. Can we learn from those empirical estimates how much of this pattern of suicide decline can be attributed to policies, particularly the China Action Plan for Air Pollution Prevention and Control, which was enacted in 2013 and led to really dramatic declines in pollution. The Clean Air Act was mentioned. These are two, I think, very important policies for us to have in mind. They took place over very different time periods, really rapid pollution control in China relative to the Clean Air Act. So what you're seeing in this map is taking the effects of that policy on air pollution combined with the empirical estimates you saw before to attribute overall as many countries as we can get data for total number of suicide deaths that we can attribute to the declines in pollution over this policy intensive period. The total deaths you can see are concentrated in very populous places that also saw a lot of pollution declines. There are a few places that you're seeing in yellow and brown in which levels have been actually elevated. Most of those are due to changing dust pollution in desert regions of the country as opposed to anthropogenic emissions. When we add this up, I realize I'm over time. When we add this up around the country, we're seeing nearly 50,000 suicides avoided over these 5 years of pollution reductions. However, this is about 10% of the overall trend in China's suicide rate decline. So this means that air pollution is playing a really important role in determining overall suicide burden, but is by no means the most important factor. And so we have to think about these environmental risks in a broader context of many other factors. And I'll wrap up here really quickly, but I just want to point out I've studied suicide and environmental risk factors for suicide in other work as well. And I think it's important to elevate air pollution to a really the forefront of our minds, given the magnitude of these effects. So in this study in China, we're finding nearly 50,000 suicides avoided with 5 years of pollution reductions. In my prior work in India, it was a similar magnitude of suicides, but it was about 30 years of global warming that it took to amount to that number of deaths. And so I think air pollution has like a very important role to play here. And it means that the levers we have on policy are incredibly important because they can be incredibly effective very quickly. So I won't take any more of your time, a few summaries, but I just want to echo what has been said about needing more research, particularly in developing countries. And then my work can only get us so far on mechanisms. I think there's a lot of important work to be done on mechanisms. Thanks so much.
Thank you very much, Dr. Carlton. I think, another like really fascinating way to be looking at this problem, and also the numbers are clearly pretty stark. I also like your message that air pollution is perhaps a part of the larger story. So finding ways to bring it in while understanding that there can be many other factors at play is very critical. So we now have a little bit of time to ask you all some questions. I know some have been coming in already, but if you're listening in and you have questions for any of the speakers, please do post them so that we can discuss them here. I would like to kick us off with one question, which I think is a little bit more general. So in all of your research, you are looking at different aspects of brain or mental health. You're utilizing different approaches, different data sets, but trying to answer that same question around how does air pollution impact brain health or mental health. For those people that are listening in and are thinking more about messaging that they can use for advocacy, for increasing awareness around these linkages, what would be your top 2 or 3 messages be for them? Joanne, sorry, if we can start with you, and then I'll come to you, Burshin, and then to you, Dama. So 2 or 3 key messages that could be relevant for engagement and advocacy around air pollution and brain and mental health.
Yeah, that's a great question. So assuming we do reach a causal understanding of air pollution and mental health, I think one key message to highlight is co-benefits. So most actions to reduce air pollution have enormous co-benefits for the climate and for mental health. So for instance, clean air zones cut carbon emissions, improve air quality, which benefits mental health, and changes land use in ways that improves walkability and access to amenities for people living in cities. And that's just one example. So there are many more, such as improving the quantity and quality of green and natural spaces in cities. So I think highlighting the co-benefits that reducing air pollution has for the climate and for mental health.
Great. That's wonderful. I think the co-benefits piece is always so critical. Borshan, what would your key messages be?
Sure, thank you. And yeah, Joanne, I love that message too. I would say one is to really put it across that air pollution um, has strong implications for impacting brain and mental health. I think it's like we have said that there has to be, when we look at reports that are coming from Lancet and World Health Organization and so on, I think there's still what happens to the brain is still a very understated issue, and that needs to be really emphasized and shown. And the other thing would be that we really have to focus our efforts on understanding and also in terms of solutions and adaptation, focus really on the vulnerable communities, frontline communities from lower and middle income countries, and that we have to, in order to do that, we have to really be working together as scientists, healthcare professionals, policy experts from around the world, really listen to the people with lived experiences and be able to working together as communities.
Fantastic. Tama,
Yeah, going last isn't fair because I'd just like to echo my colleagues, but I think one just summary statement I will say to add on is just the idea that pollution policy is mental health policy. I think we think of these things as often quite separate, and the policy conversations are quite separate. And of course, there are many components that are distinct, but I think what I've learned from this research is just the critical role that air pollution policy plays in shaping mental health outcomes. And so if we can try to bring policymakers and the people working around policy development together on these two problems, I think we have a lot of possible gains to be made.
great. I think those are all really useful messages, and hopefully, we'll get some ideas started in people's minds as they're listening to these conversations. There are a couple of specific questions on the top, so I'll maybe shift to those for a couple of minutes. There is a question for you, Joanne, from Rachel Horta for the study in Bristol. Can you, talk a little bit more on the impact of noise or sound and how that played into the analysis?
Yes, thank you. Thank you, Rachel, for the question. So, yeah, in our study, we found that noise pollution in childhood and adolescence was associated with elevated odds for anxiety between ages 13 and 24. But interestingly, it wasn't associated with depression and psychotic symptoms. But one important thing in our study is that we controlled noise pollution for air pollution and vice versa. So we were able to sort of tease out the effects of each. One limitation with the noise pollution data in our study is that it estimated only decibels, as in loudness. And there are many other aspects of noise pollution and noise, which could be potentially more relevant to mental health, such as pitch and predictability. And I think that this is definitely a field that requires more research going forward.
Great. One other question that just came in was around, youth in LMICs that may be working on policy change around air pollution and health. Do you have any tips for them? What are the things they should be thinking about or advocating for that will help move this conversation forward and lead to action? Borshan, perhaps I will start with you this time, go to Tama, and then come to Joanne.
Yes, absolutely. It's such an important issue, and I think in the policy talks around climate change or environment and air pollution and health, I think it's really important to emphasize the One Health aspect. And Joanne had mentioned about the co-benefits. It's really what we can do for our planetary health will also impact and be good for our own health. Even at the policy level, community levels, or even in personal levels, the steps we take, the decisions we make in our daily lives for our better health will be also good for the planet's health. So I think it's really important to really put it inform policymakers, governments, and so on, about local governments, about how important it is that when we talk about health, we also have to talk about the environment that we live in, that they are together, and vice versa, and really target the policy approaches from that thinking that they're together, it's one health, and they're linked.
Yeah, I think that as an economist, maybe this shows my bias, but I think what's exciting about where we are at with the research right now is we have emerging quantitative estimates that you can leverage as you're thinking about advocacy. So, I mean, the Health Effects Institute results that Pallavi was just presenting, the Lancet Countdown has some really powerful results. I think especially as you thinking forward about lifelong impacts of air pollution exposure and about your lifespan under climate change, you now have at your disposal really powerful aggregate estimates of how many people's lives are at risk and to what extent. And I think leveraging those in advocacy is incredibly powerful, because before we were able to say things like, we know there is a connection here and we know it's likely important, but we actually can talk about the millions of lives potentially lost, potentially saved. And I think leveraging those resources that are out there to use those quantitative estimates in advocacy can be really powerful.
I've got the short straw of coming last this time. Those are really good points. I think another point to make is about building capacity for research in different global contexts. And I think a lot of this lies with the responsibility of funders. So looking at longer term investment in the necessary resources and data in developing countries. I think there's also a responsibility of like Western researchers not to sort of continue with helicopter research, but to build really strong collaborations for research in different global contexts. And it must be led by researchers based in the country of focus. That's just one point I wanted to make.
Yeah, I think those are all excellent point, and one of the things that really came through in all of your talks was the availability of the right data set that will help answer the questions that we would like to. And I'm curious if you can talk a little bit more about the types of data sets that could be leveraged. What we've seen in the context of other air pollution and health research is that even if there aren't data sets that were especially curated for air pollution work, we're able to leverage data sets that may have been gathered for other public health problems, and then we apply air pollution on top of it, so it fastens the process a little bit. So what kind of data sets could be useful that may be available in some places, perhaps not all places, that could help us strengthen the research that we want to build around air pollution and mental health? And Tama, perhaps this time I will start with you, come to you, Joanne, and then go to Bochin.
Yeah, great question. And it's an exciting time to be a researcher, because sort of the data landscape is changing really rapidly with very novel forms of data. So in my work, a more traditional answer to this question is there's a lot of standard vital statistics type information at administrative levels that are tracking causes of death. Or, one of the reasons I've done so much work on suicide is that is often recorded where other mental health indicators are not. So we've done a lot of work, and others can too, leveraging those sort of standard health statistics. But some of the more interesting, like emerging ways of leveraging new types of data sets, we talked earlier about challenges in measuring pollution, particularly in developing countries where we often have few weather monitors, much less air pollution monitors. So monitoring data, for example, in sub-Saharan Africa is incredibly difficult to get access to. But satellite data sets are now beginning to fill those gaps in a really critical way. They also have their flaws, but we can begin to see at high resolution what air pollution looks like across the African continent in a way that we couldn't before. So I think that's a really exciting area, particularly on the exposure side, where we're beginning to see environmental exposure in a way we couldn't before. And then on the outcome side, another thing to put in your mind as a sort of emerging area is people are doing really creative work with text and sentiment analysis on things like how people interact online, or how people so for Twitter or Facebook, and we can use machine learning to elicit from your public presence online what your mental health status is. Again, of course, these are imperfect indicators, but there's been some really exciting work linking things like extreme temperature and air pollution to the way that people are expressing themselves in online forums, and that gives us a new form of data that that is very large scale and sort of changes the game in terms of the scale at which we can begin to think about these relationships.
Tana covered everything I wanted to say. That was, yeah. But I think one other thing that occurred to me, although it has its own barriers, is using new technologies such as wearables and personal air quality monitors. So that opens up big opportunities for really getting more precise estimates of personal exposure. But these do remain prohibitively expensive, particularly for larger studies. But hopefully it will come a day soon when these become more affordable at a larger scale. But yeah, certainly sorry. Yeah, using satellite imagery and analysing social media content, I think, yeah, is a really big opportunity.
Yeah, I it's hard to go after these things because exactly I was thinking about the wearable tech too, but accessibility is a huge issue to be really able to afford those, Oura rings and so on. But these technologies, once being able to become more accessible, can be great ways to measure really the effects of lifestyle and environmental exposure data that we can have on people directly at personal levels and what kind of effects they have in their lifespan, in their health, mental and physical health. And I think it's really there's a lot more attention now is given to the expososome data and what it means in terms of like mechanisms of what's happening on the human body. So I think it's a very exciting time. It's just we need to really make sure that the technology follows accessibility.
Great. So some data sets for those in the audience that may be interested in looking at this in more detail. I think one other part which is really critical and important to take into consideration, especially in the context of mental health, is the experience of those who have lived experience. Because a lot of us would like to do research and find quantitative estimates and numbers, but a lot of it really is people experiencing those effects in real time. And do you have ideas or ways in which those lived experiences can be integrated into building both the evidence base, but also how the messaging around this topic can happen, and how we engage those people, and how we also learn from the lived experience to communicate better around what this really means to us on a personal level? Joanne, maybe I'll start with you, go to Burshan, and then go to Tava.
Thank you, Pallavi. Yeah, that's such a good point. So research has a very long life cycle from when you start to plan the research, apply for funding, getting the data, conducting the analysis, and presenting the findings. And it's really just essential that people with lived experiences of mental health difficulties and of living in disadvantaged, polluted neighbourhoods are involved at every stage. And I think this means making meaningful connections to co-develop the research with people with lived experiences at the very start. So for the current project I'm planning, I've partnered with a mental health charity who specialise in involving people with lived experiences. So I think looking out for those kinds of charities who want to involve or like specialise in involving people is a good place to start. And they've provided really important feedback, which has shaped my research proposal. And I'll continue working with the group if the research is funded, going forward. And I think that's something that's people with lived experiences are particularly expert in, is knowing how to communicate the findings to key audiences, what the key messages are, why is it important, so that the research just doesn't go into a paper and get forgotten about.
Yeah, I think really listening and highlighting the lived experience is really important at research level, advocacy level, and policy level. For 20 years, I have worked on trying to understand, really going into the mechanisms, molecular cellular mechanisms, understanding diseases, brain diseases. And one thing I have learned that is that we have to listen to people with lived experiences, patients that are having these diseases, to really actually, even as a researcher, um, to understand what the disease is. And there's such a gap between the scientists working in the lab with their pipettes and lab coats and people actually going through communities and families that are going through these health difficulty challenges. And there's a it's very we have seen it even in, and it's actually having that bridge and make them communicate with one another really could be beneficial to both sides, and for the research to be able to really understand truly what they're studying, what they're understanding. One example comes from Parkinson's disease. For many years, researchers, for a century, researchers had focused on what happens on the brain in Parkinson's, is trying to really go into deep parts of the substantia nigra, trying to understand the mechanisms. And we're now starting to understand that the disease may be even starting from the gut. And when you look at the first observations that were done by Dr. Parkinson himself, who named the disease, and when his description of the first patient, before he starts talking about any neurological symptoms, he starts talking about that the patient had gone through for many, many years, had difficulties with gastrointestinal issues. And now we're seeing that, actually, the disease may be starting in the enteric neurons in the gut and move through the gut-brain axis. But for many years, people just didn't pay attention because the neurological symptoms were so prominent that neuroscientists love working on the neurons in themselves. But now we understand that the body is, as a whole, it's connected, and we have to really think about holistically understanding about health. And I think it goes into thinking holistically, not just around our body, but also around our environment and so on. And it's so important to listen to the lived experiences because of that.
So as sort of representing a big data type perspective to these problems, I think honestly this is a huge challenge going forward, and I don't think we're necessarily doing a great job at incorporating lived experiences into the sort of population scale type analyses that I do. And I think as remote sensing and satellite data, these exciting data formats take off, I think this challenge only rises. And so unlike Joanne, I think I'm not as much going to be able to point to great examples of this. I think it's an ongoing challenge. I think currently, if I think about that type of work in my own and my colleagues' work, the way that we currently bring in lived experiences, I think is modest, but the way that it manifests often is I use anthropological or ethnographic analyses to help form hypotheses. So where do my hypotheses come from? For example, I've worked on suicide and climate change in India, and a lot of the formation of the hypotheses around that study came from ethnographic work in individual villages. That was not me directly interacting with people, but that has been an avenue into hypothesis formation. And then, like Burchin was saying, on the other end of the research sort of pipeline, then it comes in through the result dissemination. And so the ways that I have tried to get these results out into the world for feedback and for advocacy often come through working with media, particularly in the countries that I'm studying. But again, I think that's an insufficient way to integrate these direct experiences. And I think there's a lot more to be done. And I think one more sort of modest step is, like we've said before, simply collaborating with people in the countries that we study. So all of my co-authors on this paper are Chinese. We tried really hard to get them to come today, but they were not available. But even, for example, we were really stuck in writing this paper on trying to understand why it was the elderly women that were most affected, and their perspectives working within the Chinese Center of Disease Control and understanding sort of cultural changes that have happened in recent periods around outmigration from rural areas, and a lot of older women being left in rural areas without traditional family structures, were really helpful in us sort of forming hypotheses and tests around why we were seeing what we're seeing in the data. But those are a few modest examples. I think there's a lot more we can do to merge lived experiences with this big data approach. And I think it's a challenge we should have a center of mind going forward.
Those are really good examples, and clearly a lot more for us to do. We are very rapidly coming to the close of the session, so I would like to invite all of the panelists now to give us a very short tweet length answer to this phrase: to protect mental and brain health in the context of air pollution, we must dot dot dot. And Burchin, I'll start with you, go to Joanne, and then come to you, Tama.
Yes, we must bring together multidisciplinary teams and communities of scientists, healthcare professionals, policy experts, and vulnerable communities, people living in the most vulnerable communities, to come together and work to address the brain challenges that come from air pollution.
We must advocate for cleaner air in our cities and towns.
Mine is going to echo yours. We must advocate for air pollution prevention policies, particularly in developing and emerging economies where pollution levels continue to far exceed World Health Organization standards.
We must also bring together the data and the stories and experiences of people so that we can platform the right messages to the right people. This has been a fascinating discussion. I hope that everyone in the audience, I know we've had some technical challenges, but everyone who was able to listen in had something new and interesting that they learned. I really want to thank all of our panelists today for taking the time to join us. I know some of you are joining from odd time zones, so it's very early for you. So thank you very much for making that happen. And thank you also to everyone who joined us for this conversation, participated, asked questions, and also a special thanks to Divya and Ale, who worked behind the scenes to bring this exciting panel together. The next webinar in the series is going to be on advocating for mental health when the world is watching. So please make sure you save the date and sign up for that one. We will continue the conversation around air pollution and brain and mental health on Circle. I believe the link has already been posted. It will be posted again. And as the speakers and the panelists highlighted, we know that air pollution is connected to our brain health and mental health. I think also, and very importantly, these are lifelong impacts. So we're not necessarily, experiencing this one time event or time point when these impacts might be felt. This really is a lifelong process. So we need to be thinking about it, planning for it, and mitigating it in that life course perspective. There is still a lot more research to be done, data to be compiled. So hopefully the researchers in the community can continue working on it, especially in low and middle income countries. And finally, we do know enough, despite all the research that is needed, we do know enough now on the connections to begin to sensitize our policymakers, the general public, and other specific communities so that public health policy, I think, Tama, as you mentioned, mental health policies and other general public health policies can begin to take air pollution into consideration. And of course, finally, air pollution is not a problem that exists in isolation. Climate change that we are now living through is sort of, part and parcel of this process as well. So thinking about solutions that can be integrated, solutions that can bring the most benefits for all is what we need to be working towards. So with that, we will close today's session. Once again, thank you everyone, and we will continue the conversation on Circle. Goodbye.